With over 160,000 patients treated, cooled thermotherapy treatment can solve the problem of your enlarged prostate. In this program, you will hear the experiences of actual patients who have been treated with cooled thermotherapy. Glenn Jacobson has always been energetic. With family, in his work, and at play, he has enjoyed an active lifestyle. But recently, he began to experience some interference in his daily activities due to the symptoms of a condition called enlarged prostate. Soon, his symptoms became a daily challenge and frustration.
Well, I think the frequency of urination did affect my daily activities, and I found that I had to measure my time in terms of how close I was to a bathroom.
Every day, the lives of more than 23 million men are affected by the same condition. Enlarged prostate, also known as benign prostatic hyperplasia, or BPH. The symptoms of enlarged prostate include frequent and urgent urination during the day and night, difficulty starting and stopping urination, a weak urine flow, and possibly incontinence. Also, men can experience the feeling of not being able to completely empty their bladder, and some may experience interference with sexual activity.
Always going to the bathroom constantly, and that increased. It increased to the point where I couldn't get a good night's sleep.
My quality of life was diminished. Was causing me to get up in the middle of the night, several times a night, more than 3. This was very disrupting to my sleep and my wife's sleep.
And I had some urgencies. I had, it was kind of a problem that I needed to look for restrooms many, many times. And so it was quite uncomfortable.
This is kind of squeezing the urine passage.
Enlarged prostate is common to more than half of all men over the age of 50. It is a non-cancerous disorder in which the prostate begins to grow as a normal part of the aging process. Again, it does not lead to and is not associated with cancer. The symptoms of an enlarged prostate are well understood, and your physician or urologist can explain them. The prostate gland, located just below the bladder, is about the size and shape of a walnut. The primary function of the prostate is to produce semen, the fluid that carries sperm. The prostate surrounds a portion of the urethra, which is the tube that carries urine from the bladder out of the body. When the prostate becomes enlarged, it compresses the urethra, causing difficulty with urination. Enlarged prostate is not life-threatening. However, if left untreated, it may lead to more serious health problems over time, including urinary tract and prostate infections, and possible permanent damage to the bladder and kidneys. The good news is there are several treatment options available. Examination and testing by your physician will help determine the exact nature of your prostate symptoms. Together, you will decide which treatment is best for your individual condition. The primary treatment options for enlarged prostate are medication, surgery, and cooled thermotherapy. Medication is frequently used to control mild to moderate symptoms of enlarged prostate.
There are several medications that patients can take for prostate enlargement. However, when taking medication, there are side effects that can occur. Medication is usually something that patients have to take every day for the rest of their lives. In many cases, medications after a while lose their effectiveness because the prostate continues to grow, and eventually patients will have to have some other form of treatment.
In the past, surgery was another common treatment for enlarged prostate, but today, surgery is usually indicated for more severe symptoms or is recommended if there are complicating factors such as frequent urinary tract infections, kidney damage from urine retention, bleeding through the urethra, or stones in the bladder.
What we've learned is that surgery has the potential for complications. For example, many patients develop scar tissue, there can be difficulty with erections later on, infections may develop, and most patients can't return to normal activities for at least 6 weeks.
Your physician may have already advised you about the third option, cooled thermotherapy. This treatment has many of the advantages of medication and surgery with few side effects. Cooled thermotherapy uses precisely targeted thermal energy to actually shrink the enlarged prostate without damaging the surrounding healthy tissue.
After 7 years of studies, I know that my patients experience a greater relief of symptoms when compared with medication and less side effects or complications when compared with surgery.
It was pretty much of an easy choice for me, being scared of the surgery table and the knife and being out 6 to 8 weeks. So I did choose the cooled thermotherapy.
So we actually waited 3 years. And when this procedure became available, this is what I knew was best for me and my wife and for my family and my life.
Cooled thermotherapy is a non-surgical office-based treatment that is performed during a single treatment session in your urologist's office. When you come for your exam, the urologist will explain the treatment in detail, answer any questions you may have, and give you detailed instructions on what to do prior to treatment.
Typically, we ask patients to reduce their fluid intake beginning the evening before the procedure. On the day of the procedure, patients can have a light breakfast or a liquid breakfast. They'll receive an enema either the morning of the procedure or the night before, and that's all that's required.
For treatment, you will be comfortably positioned on a treatment bed, and you may be able to watch television, read a book, or listen to music while the procedure is being performed. The treatment generally takes 30 minutes.
Basically, you are placed on an exam table. On the exam table, the first thing that the nurse does is to put in a catheter and empty your bladder, because you don't want a full bladder during the procedure, so we empty it out, and then we put a little bit of what we call a xylocaine fluid. That's a little numbing fluid into the bladder, so it kind of anesthetizes your bladder. The next step that the nurse will do is to put in a catheter which contains the microwave antenna. He positions that. There's a little balloon at the tip of it, so he'll put a little fluid so that stays secured in the bladder. Then he'll turn you over and put a rectal probe that monitors the temperature. This is just for safety purposes so that we don't exceed the temperature limit. Once that's in place, we start the treatment.
The cooled thermotherapy device delivers precisely targeted heat that destroys the enlarged prostate tissue that is placing pressure on the urethra. At the same time that the device is heating prostate tissue, cool water is circulated through the catheter to protect and draw heat away from the urethra and surrounding healthy tissue, increasing the patient's comfort during treatment.
During the procedure, patients may experience a sensation of warmth in the prostate, and some patients have a strong urge to urinate. We usually give medication during the procedure to reduce these effects.
When the procedure is finished, you will be given your after-treatment instructions, and the recovery period will be explained to you. As no general anesthesia is required for the procedure, you will be able to go home shortly after treatment. Because you may have been given some medication to help you relax, you will need to have someone to drive you home.
Then the procedure took about 30 minutes, which I just laid there. And because of the sedative, I was able to relax. And looking back at it, it was painless. I think if there was any pain involved at all, it was my anticipation of what to expect. But coming through it, it was not painful at all.
One of the most remarkable things that I've seen as a physician in treating patients with benign prostate enlargement is how quickly patients who have cooled thermotherapy return to normal activities. With surgery, we keep patients out of normal activities for at least 6 weeks. With cooled thermotherapy, most patients go back to normal activities the next day.
Approximately half of all patients go home with a urinary catheter in place. This allows urine to drain from your bladder while the swelling goes away. Generally, the catheter is in place for 2 to 5 days. While at home, your doctor may advise you to avoid excessive activity and heavy or strenuous lifting. You should drink plenty of fluids. A glass every 2 hours is recommended while the catheter is in place.
Most of my patients remove the catheter at home. We instruct them, and they're happy to do that. Once the catheter is removed, I tell them that they're going to have frequency, a little burning. You know, that's a healing process.
For some men, the next few days after the procedure can be uncomfortable, and you may experience a few effects from the treatment. You might have soreness or aching in the lower abdomen, urethra, or prostate. Urgency to urinate even after the catheter has been removed. Frequent urination or bladder spasms.
If a patient experiences burning or frequent urination after the procedure, we will usually give some medication to calm those symptoms down. Within 1 to 2 weeks after the procedure, most patients require no medication of this type.
I feel that it's gone very well. At first, I did have some problems on urinating because of swelling.
The first 2 or 3 days were uncomfortable but bearable.
Relief is gradual. It may seem as if there is no change in your symptoms at first. However, your body is working on healing itself. The once enlarged prostate is getting smaller as the tissue destroyed by cooled thermotherapy is reduced. As your prostate shrinks, the pressure on your urethra is relieved. Within a matter of weeks, you'll see most or all of your symptoms diminish or completely disappear. Although every person is different, most men start to see significant, long-lasting results in 6 to 12 weeks.
We have now been able to follow patients for 7 years after cooled thermotherapy procedures, and what we have found is that the results are comparable to those patients who have had prostate surgery, and again, they've been able to achieve those results without the complications or side effects of a surgical procedure.
Cooled thermotherapy can allow you to quickly resume the activities of daily life without the symptoms caused by an enlarged prostate. Cooled thermotherapy treatment is a safe and effective procedure covered by Medicare and most insurance carriers.
Since the procedure, I've been able to resume my normal life pattern. My wife and I walk not every morning, but we walk frequently for 2 miles. And so I would say that my life pattern is very, very normal, and I'm very pleased with it.
I would say that the procedure has been very successful for me. The fact that you can get a good night's sleep. Until you don't get a good night's sleep, you don't realize the value in it.
It's been a great success for me. It's changed my life tenfold, and I couldn't recommend it enough for you.
I highly recommend this to anybody. If they're having any trouble, and if it's just started, don't wait.
The quality of life that I had before was nothing as compared to what I'm having today. And I'm very grateful for having this procedure available for me.
More than 160,000 men worldwide have received cooled thermotherapy. If you have not already done so, now is a great time to talk to your urologist about whether cooled thermotherapy is the right treatment option for you.